Our next speaker, I think he recorded 2 videos.
It should be.
Yes. Dr. Cacciamani. The first presentation is Artificial Intelligence in Surgical Education.
Again, I'm Dr. Cacciamani. I'm Associate Professor of Urology and Radiology Research at the University of Southern California and Director and Head of the Lab in Artificial Intelligence Center at the USC. I want to thank again the committee and the chairs for inviting me over to discuss artificial intelligence in surgical education and complications. We know that there are a lot of potential applications of artificial intelligence, specifically in surgery. The data source that can be used are feedbacks and assessment repository, as well as any kind of sensor or patient-derived data. And of course, the surgical videos. Technically, any surgery that has a video that can be from robotics to laparoscopy to endoscopy are technically those kind of surgeries that can be analyzed by artificial intelligence. The artificial intelligence field in the surgery can be evaluated in 4 different buckets. Before the surgery, when we can have a better patient assessment, we can make a clinical note organization, surgical procedure scheduling, for example, and surgical procedure clearance, as well as the patient education and patient consent. But it's during the surgery where actually we can put in place any kind of potential application of artificial intelligence in education, as well as in the prevention of potential adverse events. We know that learning from our mistakes is the best way for educating in surgery. We know that artificial intelligence, for example, can be analyzed by surgical annotation. As you can see here, the experts usually make annotation on surgical videos. The system will identify the go and no-go zones, and through training of the AI model, we can create what we call the real-time artificial intelligence augmented reality surgical experience, as you can see on the right side of this slide. And of course, those could potentially lead to what we call the automated annotation. Other potential application of artificial intelligence is the surgical structures real-time identification. As you can see here from this video and courtesy from Endolux, the system is trained on thousands of videos and automatically is able to detect, in this case, the lobe of the prostate as well as the verumontanum that can be used during the surgical procedure to train the new trainees, but also for improving and reducing the potential complications. New frontiers on the use of artificial intelligence are coming from generative AI. We know that generative AI is a new frontier of artificial intelligence, is a subfield of machine learning, and is basically able to generate new concepts and new things starting from images or data. And new system from the newest member of the family of Gemini in Google is showing that now the system with proper trained can actually identify the different type of anatomical structures and therefore guiding the surgeon during the procedure. So coming back to the potential application of artificial intelligence, we were talking about the fact that education is coming from learning from mistakes. And those mistakes in the arena of the surgery are complications. We know that adverse events are defined as any unfavorable outcome that occurs during and after the use of a drug or an intervention. And there is a causal relationship between the intervention and the event that is at least a reasonable possibility. And complications are part of the adverse events, is an adverse event or effect following a surgical or other invasive interventions. Now, when we are looking, for example, the definition of artificial intelligence, as you can see here, the definition of adverse events is extremely heterogeneous. As you can see here in the definition from Claviandindo, BMJ, from the NIH, it seems that complications are happening always after the surgical procedure, in the post-operative period, when actually complication can happen also during the surgical procedure. We know that over the year, there are millions of operations, 200 to 300 millions of operations worldwide. We have 2 million of surgeon anesthesiology all over the world, yet the adverse events is always between 3 and 5%. This actually number could potentially be biased by the fact that, first, we don't have a clear classification and nomenclature about the intraoperative adverse events, and that's why the ICARUS Global Surgical Collaboration is working together with 5,000 surgeons in the 13 different surgical fields for providing a new definition of those events. But on the other side, it can be also related to the fact that there is not yet an unbiased way for recording those events and providing for educational purposes a better way for collecting those events and classifying those events. Now, where is the problem? First, the lack of definition, as I was mentioning before, the lack of applicability of intraoperative adverse events grading systems. There are too many grading systems and they are conflicting each other with a very low inter-rater reliability. There is a lack of unbiased assessment, a lack of common ground that we can use for defining and therefore to having a system that in an unbiased way during the surgery can advise the surgeon that something could potentially happen, near missed events, or if something happened, recording it and therefore keeping it in storage in the records for making sure that this information will be passed through the team that will assist the patient after the surgery. We're looking at, for example, those systems are this is the results of Therefore, specifically for the unbiased assessment, artificial intelligence could potentially be the perfect ally for, in an unbiased way, in an automatic way, and real-time way, recording the intraoperative adverse events, storing them, and advising the surgeon that something is happening, or if something happened, advising the team that will take care of the patient after the surgery to making sure that this kind of information will not be lost. We know that 48% of all the intraoperative adverse events could potentially preventable, and artificial intelligence are not routinely assessed, collected, neither graded or reported. And again, a prospective real-time observation and capturing of the intraoperative adverse events is limited in the majority of the cases by logistic, technical, and cost constraint. And specifically for intraoperative adverse events, currently only data for retrospective analysis like core bias, selection bias, and incomplete records actually can impact drastically and negatively on the way that those events are collected. So therefore AI is an option. And deep learning, specifically computer vision algorithms, can identify dangerous anatomy planes, for example, or potential surgical misstep in a real time during the surgery, looking at the surgical video. For example, artificial intelligence can be used for intraoperative adverse event detection during cataract surgery. In this case, the authors look at these cataract surgeries. They use a dataset of 425 videos recording of this kind of surgery. They used 310 for training data, 15 for the validation, and then 10 were used for testing the data. And the kind of intraoperative adverse event in this case were vitreous prolapse, capsular ruptures, etc. And they use the Inception V3, is a neural network that can be used for identifying immediately the intraoperative adverse events. This system was able to detect the intraoperative adverse events faster than the ophthalmologist and the surgeon 95% of the time. This kind of technology will be implemented in ophthalmology surgery very soon, and hopefully this kind of technology could potentially be used also in urology, specifically for robotic surgery, for guiding the surgeon and preventing intraoperative adverse events. Another example is, in this case, the automated detection for intracranial vessel perforation. As you can see here, in this case, the setting is endovascular therapy. The dataset was almost 4,000 patients from 3 different types of databases. The intraoperative adverse event in this case was intracranial vessel perforation. And what they figured out is that using the spatial temporal network, the eye was performing a similar level as expert radiologist in identifying this kind of intraoperative adverse events. Another example is detection of potential bleeding through computer vision during the surgery. Imagine you're doing a surgery, you have a vessel that is start bleeding, and sometimes those vessels are retiring themselves in a way that are very difficult to be found, especially when you have a lot of blood that is covering them and therefore is not making them available to the human eye for being immediately detected and therefore for making into place any kind of surgical action for fixing the problem. So in this case, the surgeries were done laparoscopically and robotically. They were collected different type of surgeries. The intraoperative adverse events in this case was a bleeding, and the type of artificial intelligence used in this case was computer vision algorithm, especially open sources. And Another example for automated source of active bleeding and detection in laparoscopy surgery is reported here from Juan and colleagues in 2022. In the setting of different type of laparoscopic surgeries and with a dataset of 12 bleeding videos, as you can see here, they use RCNN for detecting basically any kind of source of active bleeding during the surgery. This kind of artificial intelligence step forward in the detection on real time during the surgery about active bleeding is extremely important, because they will ensure that if there is an active bleeding, the system will identify that and advise the surgeon to fix the problem right away. Another example is also this paper by Okamoto and colleagues published in 2019 with the real-time identification of blood regions and hemostasis support in laparoscopic surgery. In this case, again, a dataset of 10 videos was used. The intraoperative adverse events to be evaluated was the bleeding. And as a ground truth, they use an established videos annotated by surgeons. And the outcome, of course, shows that the artificial intelligence is not only able to detect the blood region, the bloody regions, but also detecting in real time during the surgery. Another important point that we have to consider is that how artificial intelligence is good in detecting intraoperative adverse events during the surgeries. And looking at this systematic review and meta-analysis that our team just published recently in the Journal of Clinical Medicine, we find out that combining the data of all the papers that were looking at the impact and performance of artificial intelligence solutions in the detection of intraoperative adverse events show an accuracy, a cumulative accuracy of 0.7, making the point that this kind of artificial intelligence is able to detect intraoperative adverse events in real time, but of course has the limitation of different data sets. The number of the surgeries used for training the model in the majority of the cases is low, and the majority of the times the performance reported is only on training and not on the validation. What those evidences suggest? Well, in this case, AI can be excellent for surgical real-time guidance during the surgery. It can advise the surgeon if something happened, and therefore for the surgeon to make it into place, into action, any kind of action to reduce the effect of the intraoperative adverse events during the surgery. And it can be helpful also, as we saw, for evaluating variant anatomy identification, specifically for the use of the newest release of generative AI. It can also be used for an unbiased assessment of intraoperative adverse events, and therefore improving the self-education of physicians, and why not improving the education of other trainees. An unbiased way for assessment of intraoperative adverse events find a real fertile ground in surgery, where intraoperative adverse events are required to be collected prospectively and in an unbiased manner. And of course, this automated collection and automated grading will be extremely helpful then for informing not only the surgical team, but also the team that will take care of the patient after the surgery. Thank you.